I'm Audrey Dudzik, and I didn't always want to be a doctor. But when I was about 7, I was at a Girl Scout camp, one of these with the platform tents, and during our quiet time at the tent, one of my tent mates had an illicit sucker, and she was sucking on her lollipop, and it came off the stick and got stuck in her throat. So I acted fast and did the Heimlich maneuver like my Girl Scout first aid classes had taught me to. And sure enough, that sucker went flying out of her mouth, arced across the tent before the other girls had time to come back with the counselor. And the other girls said to me, "You saved her life." And I thought, I did. And I just loved that feeling of being helpful and being able to physically do something to help another person, especially in a really scary time. So that's when I got the idea to be a doctor. So my mother is my biggest influence because she always really pushed me to do my absolute best at all times, and also to always strive for more, to never let being a woman hold me back, to be confident in myself, and to recognize the skills that I have that I can share with the world. So some of my best moments as a doctor have actually been in the office talking to patients. Knowing that after it's all over, they feel so much better that they can move on with their lives. People being really pleased with how their scar looks, which is usually, I try to make it like I was never there. That doesn't always work, but for the majority of people, we're able to achieve that. I also really like that moment when someone is in the ER and they're feeling sick and they're scared, they're in pain, they don't know what's going to happen, and I'm able to come in and tell them, this is how we're going to take care of your problem. This is what's happening with you. This is how we're going to fix it. Medicine is a team sport. I really enjoy being able to talk with my colleagues to create a care plan that is what each individual needs. As a general surgeon, I take care of many different problems for people, whether it be skin cancers, breast cancer. I have a particular interest in thyroid and parathyroid surgery in the neck. We also take care of lots of hernias, and I particularly love doing gallbladder surgery, which is the third most common surgery in the United States, unfortunately, but luckily for folks having gallbladder problems, it's a pretty easy fix. I care for our patients and customers in a compassionate and professional manner. What that means to me is that every single patient who walks through the door is treated with respect in a professional manner, and also with some hand-holding. I tell each of my patients that I'm going to be there with them every step of the way. From the beginning, knowing what to expect, how much time you may have to take off work, how long you're going to be in the hospital, through the healing process, how we're going to deal with your pain management, and also what you'll feel like down the road after it's all over. I think the important thing for people to understand is that I'm there with you every step of the way, along with the rest of the surgical team, to prepare you for what's coming so that it doesn't seem quite so scary when you get there.